Being a chiropractor myself, one of the most common questions I get asked from patients when I consult with them is, can chiropractic care, meaning chiropractic adjustments, correct or fix or cure scoliosis? And as a chiropractor coming out of chiropractic college, that's exactly what I thought I could do, meaning I could see scoliosis and knowing that I could adjust the spine and help realign vertebra, that I thought I could take a 30, 40, 50 degree curve, perform chiropractic adjustments on them, and I'll see these curves straighten out. And very quick into practice, I noticed that it was not happening, because scoliosis is not just a misalignment of the spine. Scoliosis is actually a progressive, incurable condition, meaning there is no fixing scoliosis no matter what method you're using, whether it be surgical, whether it be conservative treatment, whatever it is, there's no fixing it. However, scoliosis definitely can be managed and treated proactively with conservative treatment, and chiropractic can be a mode or a modality within that program that you're using to help manage a scoliosis patient. So how can chiropractic help? Well, when we look at chiropractic care, me saying general chiropractic care, meaning not specific for scoliosis patients, there's a very big difference in treating somebody with general chiropractic care that has scoliosis versus actually treating their scoliosis. Now, I know what you're saying is that sounds like a play on words, and it kind of is a little bit, but let me explain. A lot of patients with scoliosis will have symptoms as a result of the scoliosis: muscle spasm, pain, and whatnot. And these symptoms can help to draw a patient to a chiropractic direction, and they'll start getting some chiropractic adjustments, maybe some exercises, maybe some basic therapy, and they'll feel better. And they think that because they're feeling better, that the curve is actually reducing, but really the treatment that they're providing is helping reduce that pain and some of the symptoms that they're feeling. And that's very different than actually doing a program that's going to actually reduce the curve more than just what they're feeling. So treating the symptoms and treating the curvature is two different things, okay? But I will say getting this type of chiropractic care is definitely a step in the right direction, because there is benefits to reducing pain, reducing muscle spasm, but in itself, chiropractic adjustment is not a scoliosis treatment in reducing scoliosis. However, there are specific types of chiropractic approaches that are scoliosis specific. And the biggest and the largest out there is something called Clear Institute. Clear Institute is a nonprofit. And it's a nonprofit, and it's been around to help certified doctors, once they've graduated, to become more familiar with scoliosis and to develop protocols and systems that are more effective in reducing scoliosis, not just dealing with the symptoms of scoliosis. However, the Clear method or the Clear protocol system is more than just doing chiropractic adjustments. It is adding therapy and rehabilitation and traction and exercise and home therapy and home rehabilitation. And this sequence of care is what helps deliver the reduction in the scoliosis. In addition, the Clear protocol system is a much more intense program that normally requires several hours of care, as opposed to just going in for a few minutes. The next thing is something called ISICO. ISICO is a master's certification. They call it a world's master's certification in the management of scoliosis. Now, ISICO is not really a treatment protocol, but more like a management system for conservative treatment doctors. This system kind of gives us a broad guideline on how we would take care of patients as outside of surgical realms, meaning as patients could be or possibly progressing, how do you intervene and try to reduce this curve, and what are your outcomes and what are you trying to achieve for adolescent and adult cases. CEAS, or CAS is the correct pronunciation, is a scoliosis-specific exercise program, very similar to the Schroth or Lions or these different type of scoliosis-specific exercises. We call these SSEs, scoliosis-specific exercises, and these exercises are performed and cater to each individual scoliosis patient to match their curve, their ability to get a very specific reduction in their scoliosis. And of course, the last thing I like to talk about is something called bracing, and this is called ScoliBrace. And the reason why I like using ScoliBrace so much is not because of the name of the brace, is that ScoliBrace is a customized brace system that's actually designed to help correct and reduce a curve, not just hold it and squeeze it. And this corrective bracing is where we can have an influence on the design. And the design of the brace is what matters, not necessarily the name behind the brace. A poorly designed brace with whatever name it has doesn't matter. It's still a poorly designed brace. So what matters is having the brace designed properly and then fit properly to match the therapy and the rehab that was prescribed in the earlier things I was talking about to deliver the very best outcome. So when we look at these approaches, the reason why I call them chiropractic approaches is because they're trying to reduce the cause, which is the curve itself. They're not just treating the symptom, which could be the pain or the muscle spasm or what you're feeling as a result of the curve. So when we look for somebody or a chiropractor that's going to try to help you with your scoliosis, my biggest advice for you is not to find just a general chiropractor. Because as a chiropractor, we're normally trained to treat injuries. A patient that has an injury or they hurt their neck or their back or they hurt something that causes a misalignment or something like a subluxation and they get chiropractic care. They do a little bit of care over a long time and they get very good results with that. I did that for years. But scoliosis-specific chiropractic care is normally multimodal, it's normally much more intense, and it normally includes much more than just chiropractic adjustments. And so that needs to be managed from somebody who actually physically focuses on scoliosis-specific chiropractic. It's still a chiropractic approach, but it incorporates a multimodal approach and it complements, all those things complement each other to get the very best reduction for you. So do your data, look at the doctor that you're searching at and make sure that he is trained in managing and taking care of scoliosis. Also, make sure that you're just not his only scoliosis patient. I see that a lot of times as patients come in, they'll say, oh yeah, I'm like his worst scoliosis patient he's ever seen. Unfortunately, the worst curve I've ever seen in my office has been 155 degrees. So when I see patients come in my office with 20 or 30 or 40 degrees, I've seen that hundreds and hundreds of times. So I'm very familiar in managing that type of curve. So make sure you find a chiropractor that's trained specifically to help reduce and manage your scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.